Hello to everyone. I'm delighted to be taking part in the Diabetes Question and Answer with Expert online chat today. I've recently received a large number of questions from the audience on patients I directly treat. So today I'll answer all of your questions right here in this live stream. If you have any questions or concerns, please leave them in the comments section below my live stream. Do not miss the live stream, especially if you have diabetes or have a sick family member. Take a look to learn about the causes and best treatments of diabetes, and I'll reveal to everyone, but by the end of the live stream, I'll introduce everyone to an effective and time-tested way to treat diabetes at home. Hello, Rose. Thank you for remembering me. Is your leg swelling? Is it subsided? And Rosie, one of your many former patients who was turning in live, sorry for not introducing myself to everybody. I was too busy talking. My name is Dr. James, and I currently work at the Endocrinology Hospital in many countries, including the Philippines. I have more than 20 years of experience examining, treating diabetic patients. I just saw Rosie's response, and it is incredible. She is no longer in any pain when walking. Congratulations from the bottom of my heart. Now let's learn about the cause and treatment of diabetes. Don't forget to watch until the end of the live stream to know the best way to treat diabetes at home today. First and foremost, in order to treat the disease, we must first understand it. Why do we have diabetes and what causes it? Diabetes is classified into two types, type 1 and type 2 diabetes. Type 1 diabetes is a disease caused by the destruction of the beta cells in the pancreas, resulting in decreased or no insulin secretion, resulting in very little insulin circulated in the blood and an ability to regulate blood sugar, which is dangerous to the patient's life. Most cases occur in children or young people in this form. The disease, the symptoms appear suddenly and they progress quickly, making the disease easily detectable. Type 2 diabetes, as opposed to type 1, was previously known as diabetes or non-insulin dependent diabetes. This disease, insulin secreted by the pancreas while reacting the same amount, is normal for people. It is reduced and does not play the role in the blood sugar regulation due to progressive decrease in pancreatic beta cell function on the background of the insulin resistance. There is also gestational diabetes, which is more common in women. I've seen a lot of people asking about this here. The answer is okay. Right now, I'll explain. Anyone who has any questions, please continue to the comments. I'll answer them all during the live stream. But back to gestational diabetes. The placenta produces female hormones like estrogen and proestrogens, which act on insulin receptors on target cells, increasing insulin resistance. Linda is absolutely correct. Gestational diabetes is extremely dangerous and can result in premature birth and high blood pressure. It is not impossible to treat. However, the pancreas is unable to produce enough insulin to overcome its resistance. It leads to a buildup of sugar in the blood, which leads to diabetes during pregnancy. Is there anyone here who is pregnant, has gestational diabetes? Everyone should remember that during pregnancy, you should avoid some of the following points to stay away from gestational diabetes. Maintain a healthy weight, eat a healthy diet, and especially increase physical activity. Current diabetes causes have many complications such as blindness, limb gangrene, and so on, causing a great deal of pain for both patients and their families. As we can see, the essence of diabetes occurs when the body's insulin no longer functions properly. So when treating diabetes, this is the most important factor to consider. The majority of diabetic patients currently use Western drugs. This is the most common method, but it also has the most consequences, including liver failure, drug resistance, and so on. I get a lot of questions about diabetes from you, and I can answer each one. Question from Anna. Is my child at risk for diabetes because I have diabetes? Thank you for your question. With a diabetic parent, your child's risk of developing diabetes is 1.5 times higher than of other healthy people. To reduce this risk, maintain a healthy diet, limit sweets and starches, and exercise for at least 30 minutes, 5 days a week. It's also critical to check your blood sugar on a regular basis in order to detect pre-diabetes early. It is critical to check your baby's blood sugar status during pregnancy for early treatment to reduce the risk of hyperglycemia for both the mother and the fetus. Question from Anton. Is it correct, doctor, that diabetics can eat fruit freely? It's wrong. Although people with diabetics are encouraged to eat fruit, not all fruits can be consumed due to their GI and GL indexes. Question from John. Do I need to avoid alcohol and smoking because I have diabetes? Drinking a lot of alcohol and smoking frequently is not only bad for your health in general, it's especially bad for diabetics because alcohol and smoking both slowly destroy insulin-producing cells. Tobacco use can raise the risk of cardiovascular disease caused by diabetic complications. Question from Kim. Can I stop taking my diabetes medication once my blood sugar levels have stabilized? In this case, the patient should not stop on his own, but should seek medical attention when the doctor agrees, and is extremely beneficial to the patient because it lowers the cost that avoids the drugs and the side effects. So it is necessary to adhere to a diet and exercise and to maintain it by using herbs and therapeutic effects as described above. It is important to note that in these cases, blood sugar must be monitored at least once every 3 months in order for the doctor to schedule the next appointment. Question from William. I suspect that diabetes, I have not been tested. Could you help me to find out? Diabetic symptoms are easily to spot if you pay attention to the following things: thirst, incessant urination, excessive eating, unexplained weight loss, blurred vision, poor vision, being overweight, obesity, or both. A family member had gestational diabetes. Question from Beck. My father has diabetes, but he frequently gets difficult to heal wounds. So how can I help him? In diabetics, high blood sugar makes skin healing and scar healing difficult. As a result, infections are common in diabetics. So it is critical to keep the wound area clean and to treat it promptly to avoid further complications. Question from Mike. Is diabetes a risk for me because I am frequently stressed? Stress is not the cause of diabetes. However, for people with diabetes, frequent stress can aggravate the disease by raising blood sugar levels. Question from Anthony. What should people with diabetes eat? In order to maintain good health and keep blood sugar levels within a safe range, patients require the following diet. Divide meals evenly throughout the day so the body is never overly hungry. Choose whole, natural, nutrient-rich foods. Avoid fatty foods or foods that are overly sweet or foods that are high in calories. Consume vegetables to increase the intake. Limit your daily salt intake to less than 2,500 milligrams. Question from Ben. How frequently should I check my HbA1c? To ensure the most accurate progression of the disease, HbA1c at least should be performed every 3 to 6 months at reputable facilities. On the subject of eating and nutrition, I'd like to share with you a product, and I highly recommend it to my diabetic patients. It provides nutritional factors while also lowering and stabilizing the patient's blood sugar to a safe level. I'd like to introduce you to Gluzabet Plus, a special milk line for diabetics. I am currently using Gluzabet Plus for all of my patients, and the results are excellent. The product can be used and taken instead of main meals because it has the effect of preventing and stabilizing blood sugar, strengthening the immune system, increasing resistance, and avoiding extrasensual nutrients because of its exceptional high nutritional value. The difference is that the colostrum source is 100% imported from the United States, and the nutrient-rich milk is extracted within the first 72 hours, resulting in a high content. Furthermore, this is the first and only milk line produced using Filipino people's mechanism, making it extremely safe and effective. Aside from its primary effect of assisting in the treatment of diabetes, Gluzabet is also beneficial to patients suffering from cardiovascular problems, high blood pressure, and other common side effects of diabetes. I see a lot of diabetics using Gluzabet Plus, are very positive about the product, and they always say, thank you very much. Hin asks an excellent question. Does Gluzabet have all of the documents? There are currently many products of unknown origin, which causes many patients to be confused before using a specific product. I also thoroughly researched Gluzabet before deciding to use it on my patients. Gluzabet is currently FDA approved. A certificate of registration, Gluzabet Plus colostrum. Its distributors and manufacturing plants are well known around the world. Gluzabet Plus has been approved by the FDA for marketing. I'd like to point you in the right direction. Trust Nation Trading and Service Company is a reputable FDA licensed and tested company that has printed a distributor on each box. You can look up the company's FDA code at fdahelp.us and enter the code 12365160576. Okay, so Trust Nation distributes only FDA-approved products, and so you can be confident. Furthermore, the Gluzabet factory meets global quality GMP standards. Many of you have asked where I can order Gluzabet Plus. I've included a link below in the comments section, or you can click the Learn More button in the right corner of this video. There is currently a discount program in place to support patients. I have to go now. I have to go to work. But I hope you have good luck and a healthy life and help with your diabetes. Thank you very much for listening. Bye.